So we'll go in just like a minute here. Sarah, you ready?
Good evening, everybody. My name is Sarah Hine. I'm a nurse practitioner from Michigan. I'm very excited about this talk. You can see I have my sunglasses on right here. We're going to be talking about safety in the summertime. I have two wonderful people here with me today. I have Stacy Wood, she's a nurse from Chicago, and I have Dr. Michael McKee, who is a doctor at the University of Michigan. And I'm really excited to hear about them talk about how to stay safe in the summertime. Before we get to that, I do want to thank several people. We do have interpreters that are helping to make sure that our talk is very accessible. We have captions, so we have someone that's helping with closed captioning. We ask that you hold all of your questions until the end of the talk so that our panelists are able to answer your questions at the end of the talk. We would like to thank the University of Michigan Family Medicine, Partners in Deaf Health, and Michigan Deaf Health. And there's so many people behind the scenes that makes this happen. We are so happy to present to you tonight. So I'm going to turn this over to Dr. Michael McKee and Nurse Stacy Wood.
Okay, thank you everybody. I know the slides jumped around a little bit. So we'll talk about safety during the summer. We're really gonna focus on skin and how to keep it healthy. I know it's really popular during the summer activity to go to the beach, be out in the sun, but it's really easy to get sunburned. So I wanna talk a little bit about some good rules of thumb that you can follow to keep yourself safe. And Stacy's gonna talk more about skin protection, protecting yourself in the heat, and also how to stay dry. Thank you again to Partners of Deaf Health from Rochester for partnering with us here for MDisability at the University of Michigan, which is part of the Department of Family Medicine. Thank you so much for how you've teamed with us. And Sarah talked a little bit about that. She thanked them in the intro, so thank you again. So really, doctors are, when they do a physical exam, they want to see if there are any potential like moles or spots that are concerning on the skin. And so you might hear your doctor say it's important to protect yourself against exposure to the sun. So as they do that physical checkup, they're looking for any changes. And those are recommended to happen like every 3 months. And whether you can have your partner or someone you trust, like look at your back or other spots on your body that are hard for you to see, and to be able to notice if there are any strange spots on the skin or any spots in the skin that have changed dramatically recently. So it's important to use sunscreen especially. We'll talk about SPFs, what does that mean, and what you're gonna look for when you buy sunscreen. Don't forget to use a wide-brimmed hat. There are sometimes using a big hat, can feel a little funny, but it's good protection against the sun. I mean, many farmers use that as a good tool. Baseball players, or like, excuse me, a baseball cap, that doesn't really fully protect you. That's just a little protection over the face. So it's important to invest in a good quality hat as good sun protection. Wear sunglasses to protect your eyes. It's really easy to speed up the development of cataracts, which can be related to direct sunlight to the eyes. So sunglasses really delay any potential problems from occurring and also keep your eyesight nice and protected. Wear long sleeves, cover up with clothing, protect your skin. Clothes that have SPF, a sun factor already built in, and some clothes are even stronger than sunscreen in terms of the protection that they offer. So check the tags of any clothes that you buy, and they can give you information about that. If you're gardening, biking, rollerblading, just outside, it's important that these are things that you wear to just add extra protection. And the time of day is important to consider as well. So if it's early in the morning when the sun's just rising, or towards the evening when the sun's about to set, those are safe times. But between 10 a.m. and 4 p.m. are the worst times for direct sunlight exposure. So if you can avoid going out during those times, or like if you're going to go out and exercise, like make sure that you're under tree shade as often as possible. But let's take the beach, for example. People think that going to the beach is the same thing about as it is being under the sun in your yard, but it's not, because the reflection from the sand and the reflection from the water means that you're actually getting sometimes double the direct sunlight exposure. So it's important to put on even more sunscreen in those environments. So it's important to consider where you are and what kind of sun protection you need to have for yourself. Many people misunderstand when it comes to sunscreen. There's a range of SPFs, and it can be difficult to know what those numbers mean exactly. So SPF stands for sun protection factor. People tend to get a sunburn pretty quickly within 10 to 15 minutes of direct sunlight exposure. So while you might want to delay putting on sunscreen, you want to put it on early so that you don't get burned. Those persons with darker skin tones still burn. So while you might think that they wouldn't burn as quickly, it still happens. 30 SPF factor is like 300 minutes essentially. So every 10 minutes gets a number. So that it doesn't last though a full 5 hours. So really SPF 30 doesn't last 5 hours, even though that's the factor. The best plan is to reapply sunscreen every 2 hours. Currently, I'm in Florida right now visiting family, and the sunlight exposure is much stronger compared to the sunlight up in Michigan. So we have to apply sunscreen much more often because it wears off much more quickly. And so if you just plan on reapplying sunscreen every 2 hours, that's safe. Doesn't matter if you're doing SPF 30, 50, 70, 100. Between 30 and 50 is really good protection. Anything above that, it depends on how much you want to spend, and it depends on what the feel of the sunscreen is in terms of your preference. As long as you're applying sunscreen every 2 hours, you should be good. And something to keep in mind, if you're swimming and playing out in the water, wrestling, or really physically active by playing sports on the sand, all of that stuff's going to wear the sunscreen down more quickly. So 2 hours may not, in fact, be the right amount of time. You might want to reapply every hour or so to protect yourself better. So there are two types of sunscreen. There's one that's mineral-based, so zinc, titanium, and really you'll see in the ingredients list whether that's the main component or not. When you put that on your skin, you'll see that there's a white residue. And that's good quality sunscreen because it doesn't get absorbed by your body. And so those chemicals don't get absorbed into your skin, they don't get into your bloodstream, as opposed to the other category of sunscreen, which is more chemical based. That's your sprays, some of your rub on, and you don't really see any white residue with those. Those don't have the same thickness, they're clear, and those are avobenzones or zybenzones. They're still researching as to the effectiveness and safety of those types of chemicals. So really, your safest group of sun protection is mineral-based. I know that it can be bothersome because there's a residue. You'd rather have a sunscreen that's clear. So use sunscreen because that's safer than nothing. But if you're comparing the types of sunscreen, mineral is better for your skin. Now, there are broad coverage sunscreen because sunlight, when it's measured in UV rays, which is where these rays are hitting us, ultraviolet rays are necessary for life on Earth, right? It's very important, but in terms of skin, it's actually damaging. So UVA is one wavelength, and that's a surface burn. And don't think burn. UVA actually is more like an aging factor. So people who go lay in tanning beds, they really like that dark skin tone. Their skin's actually going to age more quickly. They're going to get wrinkles earlier. So UVA is the aging factor of direct sunlight. So sunscreen protects against UVA. Before, sunscreen would only protect against UVB, and now it protects against UVB and UVA, because UVB actually penetrates skin and damages cells. And persistent, constant damage can change spots on your skins. It can mutate, for example, a mole, and that mutation can lead to cancer. It's rare, but it still happens. So that protection is helpful to protect against UV mutations. And UVB, excuse me, that was UVA. UVB is your average, is what we would consider the type of wavelength that burns us. So what makes you turn red, when you've been out in the sun for too long, that's a UVB exposure, and that's a typical sunburn. And getting really burned isn't fun. It can ruin your trip even. So you want a sunscreen that has a broad protection for both UVA and UVB. There are UVC and others, but the atmosphere of the Earth actually reflects those rays before it even gets to us. So we're already protected. When you're buying sunscreen, check and see if your sunscreen is water resistant. For example, if you're going to be swimming throughout the day, going to the beach a lot during the summer, you want to make sure that your sunscreen is water resistant so it matches the environment that you're in. I know a lot of questions pop up about moles. So I wanted to show some images of those that aren't dangerous, or things that you can do on your own as you're doing a skin inspection. So these are 4 common ones that we see on patients. The first one is a cherry angioma. You can see it's a small, looks like a cherry, right? It's more the one on the left. It's a red spot. If you were to cut that open, it would bleed. That's why it's bright red. There's blood under there. It's not dangerous. And as persons age, they tend to see that more often on the chest, on the arms. You'll see those pop up more consistently. In the upper right, you'll see the seborrheic keratosis. And that's like what we commonly refer to as a wisdom mole. And that's just, right, damage from, skin damage that happens from age. So that's why we call it a wisdom spot. You might see it like just on your arm, and it looks almost like you can peel it off. You really couldn't peel it off very easily, but it's just a spot. It has a waxy feel, can be quite large. Again, they can show up in a variety of places on the skin. On the bottom left, we have the melanocytic nevus. This is also a common skin condition. Has a variety of colors. Sometimes it can just be the same skin tone, maybe a darker brown, light brown, pink. Really, they come in a variety of shades. It is a raised bump. It can be even with the regular skin, but it's not a funny shape. It's circular, and it has smooth edges. And the last picture on the bottom right is congenital melanocytic nevus. And that's, you can see from a young age, babies will have these. They're very similar. They commonly show up on the face, sometimes the upper body. The first three pictures that I talked about are heavily related to sun exposure. So if you don't want moles, you have to protect yourself against exposure to sun, and you will lessen your risk. Some moles change in a bad way, and they can lead to skin cancer. Skin cancer is the #1 prevalent cancer today, more than breast cancer, more than prostate cancer. Over 1 million skin cancer cases show up every year. So it's not odd, it's not rare. These are among the most common types of cancer. The most common type you'll see on the elderly, or sometimes you'll see them on middle-aged people, but it's basal cell carcinoma. And you can see what it looks like. On the left side of the nose, where the upper bump, it kind of looks like a pearl, if you imagine a pearl necklace. If you zoomed in close, though, you'd see lots of little blood vessels feeding that spot. And that's a sign of concern. On the right side, you can see the squamous cell carcinoma. And that's more dangerous in terms of the type of cancer. You have to pay attention the older you get and where you get a lot of sun exposure. What happens is a spot that looks like a typical mole, in the middle, they'll start to be like a divot or a change in shape, which is an ulcer, or the shape will spread. And that's a sign of concern. It's important to get a biopsy once a spot like that changes right away. The last picture on the bottom is the most dangerous, which is melanoma. Again, that's related to sun exposure. Melanoma can pop up anywhere. The first and second type is more sun exposure based. But melanoma sometimes can show up on your toe, the top of your head. I mean, in very odd places where you don't get a lot of sun exposure. So it's important to do a full body check of your skin to look for these things. It's also important to know your family history. If someone in your family's had these, I really recommend you go and get them looked at, go and get your skin looked at by a doctor regularly. So I wanted to give you some easy tips. People often are stumped in terms of their moles and what they should be looking for. So we'll think about it as an acronym, A, B, C, D, E. So A stands for asymmetry. So a mole, if you were to draw a line down the middle and split it in half evenly, should be even on both sides. What's concerning is when a mole's shape isn't the same on one half as it is on the other half if you were to draw a line. That's asymmetrical. B stands for border. If the edges of the mole aren't smooth, if they're jagged, spiky is another way of describing it, if they have an irregular border. C stands for color. If it's not completely brown or completely pink or neutral color. If part of it is brown and part of it's blue and another part of the mole is dark brown or has a variety of colors, that's something to be concerned about. D stands for diameter. So if you think about a pencil, the tip of a pencil, or a pencil's eraser, right? That's a pretty average size for a mole. That's 6 millimeters in diameter. And if it's larger than that, that's something to get addressed because it could become a spot of concern. So anything over 6 millimeters is concerning. And E stands for evolving. So what I do is I encourage people who are my patients to let me know, okay, has a mole, if you find a mole on your body, keep your eye on it. And if there's any changes to it, let me know, and either we'll remove it or get it biopsied. If it looks okay and I don't know, you think that there might have been a little bit of a change, it's actually even better to do a biopsy and just check to be safe. Often it comes back normal, but we would be able to catch that cancer then. Even if it looks ugly, it doesn't necessarily mean it's going to be cancerous. But these are great tools and tips to follow. I see many patients these days camp during the summer, working out in the yard, and they can develop these rashes, red spots that spread up the arms. There's one plant rash. So, it can be developed by either poison ivy, poison oak, or poison sumac. And really, we would treat these 3 outbreaks the same way. So it's important when we're talking about identifying them. If you see a plant of 3, I didn't put a picture on the slides here, but if you see a plant with 3 leaves distinctly, the phrase is leave them be, leaves of 3, leave them be, right? So that's a good way of keeping it in mind. The rash can be extremely itchy, can affect your sleep. You're constantly wanting to itch. It's very bothersome. And if you were to have an open wound on the rash, it can be easily infected. So it's important to treat the rash and the itch. There's allergy medications you can take. There's a steroid cream you can apply. And sometimes there's even a pill. The most common one is prednisone. So those are 3 medications to treat it. And if you don't treat it, the rash can go on for weeks and even months. It's really not enjoyable. I mean, obviously avoid plants of concern. So if you're chopping down trees or out camping, it can be something that you come in contact pretty regularly. And the other thing is to identify the types of foliage that are around you. If you get exposed, you can wash that spot for up to 30 minutes. Or there are two, and unfortunately, these aren't cheap, but they are over-the-counter options. The first one is Technu and Zanfel. So if by chance you found you were exposed to a poison ivy plant per se in an area, you can feel really gritty if you were to rub it. But what's really affecting you is the oil from the plants. That's like urchinol. That's the name of the chemical, the oil that's on the skin. And that's what bothers the skin and presents with a rash. Not all people will get a rash. Really, only about 40 or 50% of the people who are exposed to poison ivy will develop a rash. The other, I mean, you might call the other group immune, but really just a rash won't present itself. So it's a good idea to have some of these medications ready. That way you have them available just in your medicine cabinet. And if you were exposed, you have it as a backup. So this is more prevalent up north. This is a newer species of plant. It's not native here, but hogweed. It's a giant weed. It is not a tiny plant, 6-7 feet tall. And if you look at the leaves there, you'll see that they're pointed and jagged. I have a picture on the screen, for example. It's quite impressive, how big. Don't touch these weeds. If you do, it can leave a burning sensation on your skin for weeks. And if it gets in your eyes, not only is it a burning sensation, it's led to blindness. And a picture of the skin next to the plant just to see what the effects of this burning can be. So that the chemical burn that this plant can lead to. They grow near rivers, creeks, sometimes in the ditches on the side of the road if you see tall weeds with white flowers. Road commissions are having a difficult time clearing them out of ditches, even though they do their best. I want to switch over to Stacy to take over the rest of the presentation. Thanks, Stacy.
Hello. Hi, everyone. I'm Stacy Woods. I am a nurse here in Chicago. This is my first time joining Dr. McKee for the Deaf Health Talk. And I'm really happy to be here tonight. So today I want to talk about a couple of things. One of the important things to do is make sure that you get enough hydration, make sure you drink enough water. And why is that important? Some of the different symptoms, if you're starting to become dehydrated, those are the things that I'll talk about. So there's a lot of reasons why water is so important as part of your health. People always say, oh, sure, but I don't get sick. Well, a lot of people don't always realize that it's also good for digestion. When you're eating, it's easier to process your food if you are hydrated. It helps with constipation. If you're constipated and you can't go, drinking water really helps. Sometimes it's just healthy. It's just something good to do. It's important. So a lot of people will say you should drink 8 glasses of water, and that's kind of a good rule of thumb. And that's true, but also at the same time, it really depends. It depends on a lot of different factors. So it can depend on the environment. What's it like outside? Is it hot outside? Is it snowing? Is it very humid? So are you exercising while you're out there? Are you young? Are you older? What age are you? So 8 glasses of water actually might not be appropriate for everyone. So that's something to understand. And right now, what we're recommending for adults, adult males, 15 years older, 15 years to about 65, about 6 liters. And then for women, probably about 13 or 14 glasses. So if you'd rather follow the 8 glasses, that's fine. It won't hurt you. But if you're exercising, I really recommend that you drink more water than that. If you are doing a marathon, obviously you need a lot more. So for adults, older adults, it's kind of tough because they often have less thirst. The brain drive to drink is not the same as it was when they were younger. So it's really important to encourage older people to drink out water throughout the day. Sometimes people feel like it's boring. My mother-in-law, who lives with me here at home, I'm always telling her, please go in and drink some water, because she's older and she's like, nah, water is really boring. And I'm like, I'm sorry. And so I say, well, maybe you can experiment, add some fruit. You could add some maybe other things like cucumbers or other vegetables. You can drink milk, something like that. Something that has a lot of water content, that's fine as well. In adults who are older, it's much tougher to recognize when they become dehydrated. And at the same time, they are the most common patients that I see in the hospital that come in and are admitted because of dehydration. So it's really important to encourage people to drink throughout the day. So maybe not 8 glasses all at the same time, drink a little bit here, a little bit there, but get some through the day and remind yourself to keep drinking water. So a few things I want to talk about is what dehydration looks like. Often, if you think, oh, that's not that bad, maybe you feel a little bit thirsty. But if you're starting to feel thirsty, that's your body's signal to say, hey, you need to drink some water. And that often means that your body is already starting to get dehydrated. Your body has to tell you and remind you to drink some water because you're thirsty. So your goal is to drink regularly throughout the day so that you don't feel thirsty. And then that means your body's got the right amount of hydration. Sorry. So a few things that you might notice starting to increase, maybe your heart rate increases and it's beating really fast. Maybe you're feeling a little bit tired or lethargic. If you start to feel like you're a little confused, and the more dehydrated you get, the more confused you become, and that's not a good sign. And so you want to know what your status is for how much water you're drinking. You can always check with your skin. If you pinch part of your skin and you notice that it tense up and it goes back to flat right away, that's good. But if it tense up and then it's a really slow return to flatten out again, that means that you're dehydrated. If you know that you're not going to the bathroom as often throughout the day, that can be a sign. Or when you do go to the bathroom, you notice that your urine is a very dark color. Often when you get up to go to the bathroom, first thing in the morning, it's dark, which is fine. But if it continues to be dark throughout the day, a dark yellow throughout the day, I recommend that you drink more water. Another important thing is, when do you think that you should go in to see a doctor for dehydration? So for example, if you're noticing your heart rate is really fast, you don't feel well, you're very confused, and you feel like maybe you're ready to pass out, that is very important to make sure that you get in to see your doctor right away. Sometimes you'll be admitted and you might actually need to get fluids through an IV. So it's very important to follow up. Another thing that I want you all to keep in mind is that a lot of people seem to forget that soda pop is not helpful for hydration. So soda pop has a lot of caffeine in it, and caffeine is a natural diuretic, which means that when you drink, you automatically have to go to the bathroom. So you pretty much are telling your body, you're taking that in, bye-bye, there it goes, you're just going to pee it out. So avoid drinking that. You'll often find it also that happens in coffee and tea, soda pop. Sometimes I have patients show up and they say, I drink all the time. I drink all these bottles of Coke. I don't understand. And I think, oh, no, no, no. You are actually undoing all of the work that your body has to go through by drinking that, because you're peeing out all the water that you have. So it's really important that you drink something with a high water content without caffeine. Tea, coffee are the most common things. So sometimes in chocolate, you'll find caffeine. Okay, so it's very important to keep that in mind. I also want to talk a little bit about children. Children most of the time do pretty well at drinking enough, but a lot of parents tend to give their kids fruit juice. And again, it's not really a great way to provide hydration. So I really encourage you to instead give them water or milk. Maybe if you have to do some juice, that's okay, but not as something on a regular basis. Maybe something that a little less fruit and a little more water. So it's very important if you have infants, newborns, up to about a year old, I encourage breast milk or formula only for infants up to a year old. And the reason is because babies don't tolerate water like adults do. Other kids older than that do fine, but under 1 year old, they cannot tolerate just water. So if you meet somebody who says, oh, it's really hot outside, it's important for this baby to drink some water, please, no, don't encourage that. So something that I really encourage is to please drink at least 8 glasses of water every day. More if you're exercising. Less if you're more sedentary, if you're sitting at home. If you have air conditioning and you're cool, that's fine. If you're outside and you're in the sun constantly and you're really sweating a lot, you lose a lot of water that way. If it's very humid outside, even though there's a lot of water in the air, believe it or not, you're still sweating. So if you're outside and it's snowing, you actually are still losing water from your body. And the reason is because the sun reflects up from the snow. So you also want to think about getting into the water. Even though you might be surrounded by water, you could still become dehydrated. Sorry, I'm trying to find my slides here. So remember, it's really important to keep drinking water. And again, the reasons are it helps with digestion. It helps to avoid things like UTIs, urinary tract infection. So if you have those on a regular basis, it's a good idea to keep well hydrated. because it helps to flush out the bacteria, helps to clear out the bladder. It's really a wonderful thing to help with that. It just gives your body the things that you need. It gives your cells what they need. So you can't see them, but they need food and water just as much as you do. Hydration is also good for your joints, your elbows, your knees. If you notice that you're stiff and things don't move very well, it helps to provide some cushioning for your joints, which is really important. Another thing is that it's really important for keeping your temperature normal and avoiding constipation as well. Again, don't think, oh, water is just not anything I need. Go without it for a couple of days. It's not a good idea. So, and also make sure that you look out for older adults and remind them. Sometimes it's difficult to recognize, especially if an older adult already has some issues with forgetting or dementia. You think, oh, they're already confused. That's kind of how they are. Their heart rate is always high. They're typical. But if you notice that there's a new sign or symptom, like they're tireder than usual, they're kind of lethargic, maybe they're not as chatty, or you're noticing that they seem to have some other things that are starting to be signs, you might want to encourage them or even take them into the doctor and see what the doctor might have to say. So that's everything that I have to share. I'm happy to answer any questions and give it back over to Sarah.
Wow, I learned so much tonight. I have my giant water bottle right here, and I've been drinking water throughout the presentation. I have my sunglasses and have a jacket on. I think I'm gonna be safe. So the first question that I have tonight is for Stacy. So this audience member said that they always forget to drink water throughout the day. Do you have any tips to help make it a standard habit?
One thing I recommend is to try to figure out what you like. Or another thing is maybe set up a schedule and think, okay, I'm going to tell myself, or maybe even set an alarm on your phone. I'm going to drink 1 8-ounce glass of water for every hour. And that's kind of a good way to approach something like that. Or just bring a bottle with you that you feel comfortable taking around with you all day. That's a really wonderful way to do it as well. And if you feel like water is not really appetizing, you don't really like it, you can add fruit or something else. You can drink some other things that don't have any caffeine in them as well. Some teas don't have any caffeine. You could try something like that as well.
Okay, and the second question that I have is for Dr. McKee. And this person asked, how often should I be checking my skin for mold or lesions?
So that's a good question. General rule is that you do it every 3 to 6 months. If you've already had skin cancer, then the recommendation is definitely 3 months to really be sure that you're looking at your skin to see for any changes, and have somebody else who can check difficult areas for yourself to check. Another thing is to look at your family history, whether there's a strong background of skin cancer. You don't have to check something as regularly as like every week, but somewhere between every 3 to 6 months is a good rule of thumb.
I have another interesting question for Dr. McKee. Do you have to take vitamin D in the summertime?
Well, what's interesting, I was about, I would say 5 to 10 years ago, they were really prescribing vitamin D, but we've scaled back on that a bit. We considered vitamin D sort of like a miracle vitamin. And vitamin D is important for sure, but it's good for preventing bone loss. For women who have high risk of developing bone loss, they definitely prescribe vitamin D. And I would recommend somewhere about 800 IUs. And IU stands for international units. But in the summer with sunlight exposure, it's really easy for your body to make enough vitamin D within 15 to 20 minutes, depending on your skin tone. And so, of course, putting on sunscreen blocks that skin from getting absorbed. And so wearing sun protective clothes and sunscreen means that you're not going to get the same amount of absorption. So what I recommend is taking a calcium with vitamin D supplement. If you get a little bit of direct sunlight every day, like that's not too concerning. But if you're up north, you know, the northern hemisphere gets quite, doesn't get very much sun at all during the wintertime. So that's why it's good to supplement with vitamin D. Cold water fish, nuts, for example, milk, all these things also contain vitamin D as a nutritional value. People who are overweight or who have kidney problems, they also get prescribed vitamin D because they don't absorb vitamin D very well from food. But just in general, no, it's not something you have to take.
So I'm gonna give Daisy a question now. Is there such a thing of drinking too much water?
Yes. So what happens is your body has this perfect balance that it needs, and it's called homeostasis. I'm not sure if I spelled that right, but so that means that all of the chemicals in your body, your sodium, your potassium, your magnesium, all of those different minerals that you have in your body of all different types can get out of whack. If you have too much water, you can have some different, it's a different diagnosis. You can have something that's called hyponatremia, which means you don't have enough sodium. That's a different type of dehydration. If you have too much, it means you're not drinking enough water. And that's called hyper, which is above normal, natremia. So it's really important to drink just the middle, the right amount. So, and the only way to do that is if you go too much over. So for example, if you're the type of person who's not very active or you don't exercise and you're sedentary, you know, no one's judging you, but you don't have to worry about drinking a lot of water. You want to avoid doing that, please. If you're in some kind of competition about who can drink the most water, please avoid doing something like that as well. Don't do that.
We're gonna go back to Dr. McKee. Are there any other vitamins or supplements that I should take during the summertime?
I would say it depends on your eating habits. So if you eat a wide variety of foods and you make mostly healthy choices and you consider yourself a healthy person, then really you don't need vitamins, generally speaking. Most Americans, though, tend to have their favorite foods. They eat only a few types of dishes. They're not in peak health. And so in that case, there are a variety of health concerns that maybe a vitamin supplement would be a good regimen for. Older men, older women have to be careful in general that have vitamins that include iron, younger women need a daily iron replacement, whereas men and older women do not. So taking that really just adds no benefit. So women taking a general multivitamin with iron, as opposed to taking a general multivitamin without iron. So it's important to know the distinction. I would encourage you, though, don't rely on vitamins, rely on a healthy eating habit. Eat lots of vegetables and fruits, whole grains, good quality proteins, and eating a variety of foods means that you're going to get plenty of vitamins just from your diet.
So the question is either for Dr. McKee or for Stacy. They are asking with the sunblock, can you get a higher SPF by adding 2 bottles? They're using 2 bottles to get a higher SPF.
I wouldn't recommend mixing types of sunscreen. Again, I talked about the 2 types of sunscreen. So if it's mineral-based, that's going to really block UVA and UVB sun rays. Chemical-based absorbs more. So if you mix the 2 types, whether or not you're going to get more protective, I wouldn't recommend doing that. And I would really recommend just getting a good quality sunscreen. If you've got one that you like and you'll use every day, just stick to that one and use it. If you want more protection, then use the mineral, and you don't mind that residue that leaves on the skin, then that's the one that's a better quality sunscreen protection. But I wouldn't mix or combine sunscreens.
Okay, so the next question is for either Pamela. When I play tennis and I go to the beach and I get a sunburn, how do I treat it?
Well, I can give you a tip. I think the best way to do that is to drink a lot of water. You've lost a lot of water by getting the sunburn. So that is one thing that I think you should do. And I'm sure Dr. McKee probably has some other advice as well.
So getting a sunburn is the same thing as getting burned by scalding water, right? Your skin is in pain. So you could take some ibuprofen, Tylenol, just any over-the-counter pain medication, and that will help you feel less pain. But for the burn itself, it needs to be cooled. Also, waiting for the burn to heal, I would recommend that you try eating healthier foods, applying aloe as a salve that will hopefully heal it, but definitely you want to avoid sunscreen or sunburns in the future.
I'll also add that that's the best way for your skin to heal is a good diet. So your diet can have all of the necessary vitamins that you need in order to get your skin to heal properly.
So the next question is for Stacy. And this person said, I really like flavored water instead of drinking plain water. What is your opinion on flavored water? And she or he says that they've been using electrolyte drops to add to the water for some flavor. What do you think about that?
I think it depends on what you're drinking. I know that there are some people who really enjoy that. Again, your body has a good balance. And so it's really important to maintain that balance. You don't want to do anything to throw it off. So if you're picking something with electrolytes, it's kind of like Gatorade or something like that. That's fine if you have a little bit. If you just have a glass or 2, you should be fine. But if you drink it all of the time, I really don't recommend that. Some other things, So something, for example, like Crystal Light. That's probably a good idea. You can do that to add some flavor. It's better than nothing. So if another person wants to pick between no water at all or something with something like Crystal Light, I recommend drinking something.
Okay, so the next question is for Dr. McKee. So this person said that they bought some sunscreen last summer. Can they use that sunscreen or do they need to buy a new bottle this year?
Great question. It's interesting. There are expiration dates. Most of the time, it's right on the label. If you look at the top, right where the spray is, it's really tiny print. It's difficult to make out. But I mean, it's a good idea to replace your sunscreen every year at least. After about a year, maybe 1 year is okay, but if you're getting into multiple years, that's starting to get too old and it's going to be less effective as a protectant. So, you know, just when you're preparing everything for summer in the spring, go ahead and buy sunscreen for summer. And that's a good habit to get into, just like you would replace your medications that expire.
Okay, I'm just gonna ask if there's any more questions at this time. I'll give you a couple minutes, a minute or two. Okay, I got a question.
Great.
So this is either for Dr. McKee or for Stacy. So this question is, how do I keep my skin safe during the summertime in the swimming pool or when I go into the ocean or the lake?
So again, there's a lot that we talked about with at the beginning with sunscreen, sunglasses. There's goggles as well that you could get. I would also buy, sunscreen when you're out of the pool, obviously. There are different types of clothes that have sun protectant in it. Swimming is great exercise, so it's good for fitness. And as Stacy mentioned, though, it's being well hydrated, having enough fluids, because you can really dry yourself out pretty fast swimming. Stacy, I don't know, is there anything else you want to add to that?
No, I think you said it all pretty well. It's important to make sure you drink lots of fluids. Different outfits that you might wear for protection if you want. You can always sit in the shade, so you don't have to be out in the direct sun. That would be helpful. If you do decide that you want to go out and you're going to be swimming, make sure you reapply sunscreen probably every hour. And the reason is because it can wash off if you're in the water.
I have one last question. So either for Stacy or Dr. McKee, are there any types of sunglasses that you recommend?
All sunglasses include UVB protection. That's a standard right now. So any store, $10 sunglasses are fine.
And the labels on the sunglasses, if you look at the front, there's a sticker, and then you can see what type of protection they offer, and I recommend getting one that covers both UVA and UVB. You just find a style that you like, one that you're willing to wear often, makes you feel cool, whatever that is. Yeah.
Okay, so it's 9 o'clock and we covered everything in this talk. I want to thank Dr. McKee and Stacy for telling us all about how to stay safe in the summertime. I also want to thank our interpreters and our captioners tonight, and also want to thank the people behind the scenes that made this happen. we will see you next time, and we will announce what the next topic is. So stay tuned to your social media. So I hope you have a great night. Make sure you put your sunblock on, wear your sunglasses, and drink your water. Okay? Have a good night.
Awesome. Thank you, everybody. Have a good night. Stay healthy.